Hi, I'm Dr. Demetrio J. Aguila III. I'm a peripheral nerve surgeon and a comprehensive plastic and reconstructive surgeon. There are a lot of people out there who have nerve pain. They've got this burning sensation, or they've got an electric pain that shoots down their legs or down their arms or anywhere of any of a number of other places in their bodies. If you have nerve pain, you've probably been prescribed gabapentin or other medicines similar to that in order to treat your pain. And some of you have discovered that the gabapentin just doesn't cut it. Your pain isn't completely resolved, and you have the side effects from the gabapentin as well. A lot of you have gone back to the doctors that have prescribed the gabapentin for you, and they've told you, I'm sorry, that's all that can be done. There aren't any other options. You'll just have to deal with it. That may have been true in the past, but that's not the case any longer. A lot of patients are candidates for surgery. Specifically, people who have diabetic neuropathy or neuropathy due to chemotherapy or due to trauma, or other types of neuropathy are often candidates for surgery in order to cure their pain, not just to treat it. While it's true that not every patient is a surgical candidate, those that are can often have great results. The surgery involves releasing the nerves that are being squeezed by the surrounding tissue, allowing those nerves to return to their normal function or as close to normal as they can get. But don't just take my word for it. Let's see what JB has to say. He's a patient with peripheral neuropathy who got tired of taking the medicines. Let's hear the story in his own words.
He made incisions where nerves were at and kind of went in and cleaned around them and underneath them so that they'd lay down and not be bothered or touched by foreign objects, or cleaning the channels out where they lay is kind of how I had it in my mind. And I've been to a number of different doctors, different types of doctors, a number of different medications. Nothing worked. Everything was just short term, and then like the foot became, used to the medicine and didn't do any good. A total of 8 different people have looked at me. A foot specialist, I went to 2 pain specialists, went to a neurologist, 2 other general practitioners, went to an acupuncturist, and I even tried holistic healing. And I came here.
What was bothering you initially that kind of got you here?
Last 18 months I haven't even been able to wear socks because just a little bit of pressure across the ridge of my foot sets my toes on fire, sets my foot on fire, and I just can't stand it. If I would just tap, it would shoot pain, electrical type pain, all the way to my toes, and it would feel like they were going to just blow off. I've felt many times that if I would just take my toenails off, I could relieve pressure. You get depressed. I mean, it's just what it is. It hurts so bad that I would I might be better off with an artificial limb, because just cut it off, get rid of it. I was amazed. I was amazed about how I felt, but I was cautious because I'm thinking, okay, I'm still kind of under the drugs a little bit, so I may not be completely knowing what I'm feeling. But when I stood on it, I felt something different. It wasn't perfect, but it was nowhere near what it was, a couple hours before I laid on the table and had the operation.